Hi, my name's Elena, and this is my favorite brain part presentation. First and foremost, I want to apologize for the way that my voice sounds because allergy season is kicking my butt. So, for my presentation, I have chosen to talk about the amygdala. That is my personal favorite brain part. So, the amygdala is a small almond-shaped part of the brain located in the medial temporal lobe. In Latin, amygdala actually means almond, so that makes a lot of sense considering. The amygdala is known for creating that fight or flight response. So, when you perceive a threat, your body perceives a threat, and you get that adrenaline rush, and, you're kicked into maximum overdrive, per se. That's your amygdala. It's part of the limbic system, meaning it plays a key role in emotions, memory, and survival. So, sometimes you'll have cases where the amygdala is actually damaged, and this can be pretty crucial. The symptoms of amygdala damage can include irritability, confusion, and many other negative emotions. Now, researchers have actually destroyed the amygdala nucleus in primates and have found that when they do this, the primates no longer have fear for things that they would normally fear, such as other predators. They also displayed no normal anger, so they were pretty docile after that, which is interesting. So, also, bilateral damage to the amygdala impairs the ability for humans to recognize facial expressions, which makes sense considering the amygdala is part of the limbic system, which has to do with memory. So, the main treatment option I could find that has been shown to produce positive effects is deep brain stimulation. So, what this is a doctor will place electrodes in the areas of the brain that are associated with neurological disorders of movement, and this can kind of counteract the effects of the damage. So, the amygdala, dealing with emotions and the fight or flight response and that fear, has to do a lot with trauma in some people's cases. So, when somebody goes through a traumatic experience, that memory is imprinted onto the amygdala. It stays there. So sometimes you'll have a case where someone has, post-traumatic stress disorder, and they will go somewhere and something will trigger them into having flashbacks of their trauma, and this will create that fight or flight response because their amygdala knows what is happening, essentially, and can remember the trauma. So, childhood trauma has been shown to increase amygdala volume, some hyperactivity there as well, and traumatic stress in adulthood has shown to reduce amygdala volume, which doesn't necessarily mean that you can't still have hyperactivity. It's still there. So, the main reason the amygdala is my favorite brain part is because I have borderline personality disorder. And the amygdala plays a key role with this. So, it makes sense. My emotions are very intense. My highs are very high, and my lows are very low. So, it has been shown in studies that people with borderline personality disorder can either have a smaller than expected amygdala or unusual activity, sometimes both. Some hyperactivity is normally what happens, and we tend to have greater left amygdala activity than normal people, so that has to do a lot with facial recognition as well, and some people with borderline personality disorder will have a hard time seeing neutral faces and perceiving them as non-threatening. They will actually perceive them as threatening, even if they're just, how I look right now, so it can be very hard sometimes to not have that fear. And here are some facts that are not so fun, but I still call them fun facts. So it reaches its greatest size during puberty, which kind of makes sense considering, everything's growing. And changes in its volume can play a role in fibromyalgia and chronic pain, which is not great, but it happens. It also plays a key role in addiction, so when somebody is going through withdrawals, the amygdala can send that stress response and cause them to have bigger cravings, I guess you could say. And it was first discovered in the 1930s in monkeys. So that is the end of my presentation. Thank you for listening, and I hope you have a great rest of your day.